welcome to the Reflection Show with me, Martha and Nabila. There have been a lot of women who, unfortunately, sometimes after birth, they realize that their kids have one or two complications that they could have possibly avoided through the journey of pregnancy. Do we have to prepare for pregnancy, or we just wake up one day and realize that we are pregnant? And what happens when you find out that you are pregnant? There are some people who are unable to prevent certain things during pregnancy. Do you go for antenatal? How do you handle complications during pregnancy? And possibly, how do you know whether your child has one or two ailments even in the womb or immediately after they are born? Today, we'll be looking at the journey through pregnancy, preparing for pregnancy, and how do you even handle pregnancy on its own? Because it's a whole important issue that sometimes it's like we are not really concentrated on. Today on the Reflection Show, I'll be speaking with two amazing women who are mothers who will be sharing with us their experiences and how they were able to go through the journey of pregnancy. My name is Martha and Nabila. Let's go for a break. When we are back, we start the conversation. Welcome back from the break. Still here on the Reflection Show with me, Martha and Nabila. I've been joined in my studio by two amazing women. They are mothers who will be helping us understand the pregnancy journey. I'm here with Madam Patience Parko Agbele and Lady Pastor Dr. Prisla Alasan. She is a pediatrician specialist. I hope that's where they actually struggle to mention it. But of course, making sure that children are able to eat well and stay healthy as well. Thank you very much for joining me on the show.
Thank you for having us.
So, LP, pregnancy journey. What is the pregnancy journey all about? Are pregnancy planned or unplanned?
And pregnancies can be planned and they can be unplanned. And usually when it's planned, then you have a couple who have decided they want to have children and then they go ahead and start planning or preparing themselves for children, and especially for the process of having the children, which is a pregnancy. But sometimes they can also be unplanned, where the decision wasn't made to have a child, but then due to processes or population, the pregnancy comes into the picture. And so those are two different experiences that come with the pregnancy journey. But it depends on individuals. And so I'm sure depending on what their expectations were, then it would help make the pregnancy journey smooth or sometimes a bit rough.
How does it feel to find out that you are pregnant? Like, what is the feeling like?
Okay, so it depends on whether it was a planned pregnancy or unplanned. So if it was planned, if you can imagine yourself expecting $1 million,
Hey,
and then
it
comes. You see that kind of excitement that you have when you finally get the thing that you have been longing for. That is how initially when you find out you are pregnant, that is the feeling that you get if it was planned. But if it was unplanned, then you know that the timing probably was wrong, and so, or the circumstances are not as conducive as the person or the couple would have wanted it. And so initially it comes with some form of anxiety where they are not sure whether they should go ahead or not go ahead. But once they come to a point where they accept that the pregnancy must continue and that the outcome must be good, then they put in efforts and also make preparations to be able to carry the pregnancy through to its proper end.
Madam Patience, how did you feel when you realized you were pregnant? How many children do you have?
I have two.
Two, okay.
Yes, please.
So how did you feel? So for your first child, how did you feel?
Oh, I was happy.
Okay.
I was
Because you were expecting it?
Because I was expecting. I was expecting it.
So I want to go a bit personal because you have a special child. Is it the first or the second child that is a special child?
No, I will not say she's not.
She's a special child. So you would
So-
describe her as one of the normal children.
Yeah.
But when she was born, did you realize any ailment or sickness with her or something?
No.
Okay. Okay. But right now, how is she doing?
Oh, she's doing very well.
Is she in school? What age is she?
She's 8 years.
She's 8 years.
Yes, please.
Okay, okay. LP, so now, as somebody who is so much in helping children, what are some of the things mothers do that are not healthy during their pregnancy journey?
Okay, so I think there are a number of things and a number of habits that once you get pregnancy, there's a tendency to fall into those habits. And it sometimes does not help the progress of the pregnancy. So in order to move to the wrong, we probably would start with the right. And so with a woman planning or anticipating pregnancy, we usually encourage that women within fertility age would start taking folic acid. Once you have made a decision that you want to have children, you start taking folic acid and other food supplements, which is supposed to help you have enough stores to be able to carry pregnancy and also to help the development of the baby in your womb once you get pregnant. And so with this in mind, you also have to focus or pay very much attention to your nutrition. So balanced diet is the way to go.
Okay.
So balancing all the nutritional components into one meal, into each meal is the way to go. And also avoid refined sugars as much as possible.
Before you get into the details, I want to ask you are talking from the medical perspective. When you found that you were pregnant, were you going to the hospital and were you counseled on some of the foods you have to eat? And how was it? Was it easy or it was difficult for you?
Oh, I would say it was okay. I was taking everything. But it got to a time they advised me to take more green.
Okay.
More green. Because this
That's
thing
vegetables.
That's vegetables like this ayoyo and those things. Because they realized my HB came down. It was a little bit down. So they advised me to take those kind of things so that it will build up there.
Was there a difference between your first child and your second child, the pregnancy?
Yes.
Was one a bit difficult and one?
Yes, I would say there is a little bit different. The first one, everything was okay. Everything was just perfect. Even I'll go to the hospital, they'll check, they say everything is okay. But just that when I was due, the time passed. So I was in labor for 3 days. Yes.
Labor for 3 days.
3 days. So after the 3 days, and they realized that I cannot give birth on my so unless they do the CS. So after bringing doing the CS, they I didn't hear my child crying. So so I was hearing the doctor saying that they should rush the baby to the they should rush her to the
ICU
or something to check on her. So it was later I was discharged to the recovery room, and they came and told me my baby has a little problem. He has taken meconium.
LP, do you know what that is?
Yes.
Okay, go ahead. Yeah.
What is meconium?
Okay.
But I asked one of the nurses, the midwife, and she said meconium, the child took my feces, the child took her feces or something like that. But anyway, so I want to know.
So she too is on the show to learn more. Okay, so let me come back to the doctor. Meconium, or what do you say? LP.
Yes.
So meconium, she wants to know what meconium is. So meconium is usually the first tool that is passed by the infant or by the newborn or by the fetus. So sometimes when conditions inside the womb are not very favorable, the child can be so stressed that he would pass to in the uterus.
The uterus.
And in that case, usually you see that when the water breaks, the water that comes out is not clear, or it's not like water as it's supposed to be, but becomes yellowish, greenish, stained. And that's because the child has passed through. Usually the first two that is passed is greenish to dark green to dark. So in that case, once it gets into the fluid that is passed, that's the liquor, then it turns it's greenish. And so depending on how thick or how deeply colored it is, then they would usually use it to grade the severity. And usually the more it is, definitely the more likely that the child, in an attempt to swallow liquor, which is normal for every newborn, would have swallowed or even breathed in some of the meconium that is in the liquor. And so I believe that is what happened in her baby's case. So we would call it meconium aspiration syndrome.
That's for your first child.
Yes, please.
Okay.
So even as the doctor was saying that when you pass through those things, your baby will not be able to talk well, or your baby may not be able to walk well. But I didn't see any of those because immediately she said that, I just say I refuse it. So that's what
Words of
came out.
affirmation, yeah.
So I didn't see, and the baby also walked 10 months, and she started walking, and she talked. So I didn't see.
But do you once a while see one or two signs of your child from like having a condition, like I don't know what, like from the medical perspective, like maybe in as much as it might not be very clear, but are they some of signs in the behavior? Is it's everything okay with the child? Or once a while, do you still go for checkup?
Yeah, we went for checkup, and they said the child is okay, everything is okay.
Okay, all right. So Elby, what can cause that? Is it sometimes the eating, or what could have caused that?
Okay, so usually with the injuries that can occur during pregnancy, sometimes it's not related to the pregnancy process. There are other times that it may be related to the pregnancy process. Okay, so it depends on the kind of injury that may have occurred, but it has a whole lot of causes. And so we would call it perinatal. That means around the pregnancy and delivery period, then certain injuries can occur. But I don't know how long the child was admitted, but then usually when you have such a child who has some compromise to the respiratory system and then is not breathing so well, or have other illnesses, especially at birth, that would compromise blood flow to the brain, then usually you would have some injury occurring to the brain, simply because the brain tissue is not receiving enough oxygenated blood, that is blood carrying oxygen, which is what the brain cells would need to develop and function well. And usually once such injury occurs, it doesn't normally progress. So it happens and then it stays. And usually the injury that occurs is usually to the brain is usually not reversible. So in that case, that is when we'll have cases like cerebral palsy occurring. But there are levels to everything. So we have mild, moderate, and severe. So there are levels to everything. It's not all of them that will present with all the things that.
So it's possible her child might have a mild.
It's very possible.
It might not really show signs and symptoms.
It's very
so
possible.
It's not clear.
It's not her case is not a clear-cut case. But then definitely there's grading to everything. So there are some that are very severe to the point that they are never able to achieve their milestones, as in their development. They are not able to walk. Sometimes they can't even achieve neck control, because motor development will usually start with neck control. The neck has to be stable before the child can sit, before the child has to sit, before the child can crawl. And crawling has usually would come before the child can stand and walk. There are a few cases where the child would not crawl, would probably just shuffle on the bottom, which is, to us, it is a form of crawling. And then pull to stand, and then
they
start
start
walking.
Is that what happened to your child?
Yeah, the time that she start crawling, she did that for about some few days. So I said, what kind of crawling is this? And she turned it to the normal one again.
But is she able to speak very fluently? Is she able to move her neck and her body? How is she doing now? Is she okay? Like, do you go for therapy, or ever since the child is fine?
But ever since we were discharged at the hospital, they asked us to come for a review. That's was it 1 month later? So I went there and they checked on her before we left from to Tamale.
And ever since, you've not gone for a checkup?
Yes, please.
On that. Okay. So how about your second child? How was the experience like for you?
Like the second child, one thing I've realized is that like he's fast. He's fast. But the first one, like, he's slow. Like when you ask her to even wash the bowls, like, she's too dull. And so I'll be saying, oh, do fast, do fast. But when I say do fast, you see that she'll start doing it. But she's too dull. But the other one,
Even with talking, she's down.
oh, the talking aspect, I'll say it's okay. But she talks slow. She talks slow.
Okay. So could that probably, because it's like the after the hospital. So how long was the baby admitted? I think you asked that question.
Okay, she spent 2 weeks. They discharged almost 2 weeks. That's almost 2 weeks.
Are babies able to be admitted that long?
Some are admitted for even longer, depending on the condition that the baby has. So it all depends on the condition that the patient is being managed for. They have to manage the patient to a point where the patient can survive, or the baby can survive, without oxygen and without medication, certain medication that we give, and without IV fluids, and can survive on mother's breast milk or formula feed, depending on the circumstance of the surrounding the birth of the baby. And then that's when we discharge from hospital.
Oh,
yeah.
So you can even have a baby and you might not even go home until after the baby is fine. Is it possible to notice some of these things during pregnancy?
It is. And that is why in preparation for pregnancy, you have to enroll in the antenatal clinic. And so I think we commonly call it the ANC clinic. So let me bring that in so that everyone is clear as to what I mean by antenatal clinic. So once you book or you register for the antenatal clinic, they would initially do certain laboratory tests, generally to check the wellness or general wellness of the mother, so that if the mother already had certain conditions, medical conditions, before getting pregnant, that is likely to affect the outcome of the pregnancy, they are able to detect this. And I think the commonest ones we know of are diabetes, and then hypertension, that's high blood pressure,
I think
and
now they add
then some
HIV as well.
infections, HIV, infections, hepatitis B, hepatitis C, all those, they screen for it, so that if the mother has it, then it determines how they are going to manage this mother, or the follow-up for this mother. And also when the baby is born, there are certain things that need to be done for the baby, especially if it's an infection, so that the mother, if the mother didn't already pass the infection to the child in the uterus. Once the baby is born, certain measures are put in place to prevent the baby from getting the infection from the mother while she's breastfeeding or handling the child and moving on. And so all those investigations are done. And once those are done, then the results are usually communicated to the mother or to the parent so that they know what to expect. If there are any measures that need to be put in place, they are told. And then apart from that, they have scheduled visits. So that apart from the initial labs that were done, they go regularly depending on which stage you've gotten to. It could be a monthly visit, it could be weekly, it could be 2 weekly, depending on which stage you have gotten to. And so when you go, they check the weight to make sure the mother is gaining weight adequately and you are not over gaining or under gaining weight, because that would also influence the health of the baby. Because if you are over gaining weight, it's likely your child would also be a big baby, and in that case the mode of delivery may be affected. And also there are certain injuries that come just because the baby is big and probably wasn't detected early, and then the mother goes through the vaginal delivery. And so all those things are monitored. So they'll check the weight, they'll check the blood pressure, so that if at any point in time, if even the mother didn't have hypertension before getting pregnant, the pregnancy itself can cause hypertension, which we would call pregnancy-induced hypertension. And so in that case, they keep monitoring to make sure that the pregnancy hasn't led to that if she already didn't have. And then if it does, they put on medication, manage, and then because all that can affect the outcome of the pregnancy. And then diabetes checking too is done as you go along. And there's a whole lot of monitoring that is done. But one of the crucial things that is done is that there are ultrasound scans that are done. So usually in the first trimester, so I think, let me start by saying that pregnancy is usually divided into 3 trimesters.
Before you go into the trimesters, I want us to take a break, and when we are back, just get your pens and papers and get to understand the trimester. Some will say you vomit so much, you can't eat. So me, I want the one that I can eat well, so that I can get a lot of weight. Let's go for a break. We'll be right back.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Marcus King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of Kingdom Dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
Welcome back from the break. We are still helping ourselves to understand how we can take care of ourselves better when we get pregnant. LP, let me come back to you on this, on the trimesters. So what does the trimesters entail?
Okay, so pregnancy is divided into 3 periods. So we call them trimesters. So we have the first, second, and third trimester of pregnancy. So with the first trimester, that is the early stage of so that's the first 12, 13 weeks of pregnancy. So that's the first 3 months of pregnancy. So that's when the child is developing, the cells are dividing, the organs are growing, and that is usually when the issues would occur. But that is not the only period at which the issues can occur. Okay. And so with the second trimester, by then the organs are formed and the baby is just growing in size and in weight. And then with the third trimester, baby continues to develop in size and in weight, and those organs that were not fully developed also continue, like the brain continue developing up until the time the baby is born. And so in the first, second, and third trimesters, ultrasound scans are done, but the purpose varies because of the stage of pregnancy it's done. And so in the first trimester of pregnancy, ultrasound is done usually to date the pregnancy. And as doctors, we are more comfortable using the ultrasound, the gestational age that the ultrasound done early in pregnancy gives us. And sometimes we even prefer it to knowing the woman's last menstrual period. And so it helps us because it tells us at what stage the baby has gotten to, and it's likely to give us the estimated date of delivery if the scan is done very early in pregnancy. And so the second trimester scan is usually done to pick up any abnormalities. I went through this because you asked whether some of these problems can be identified before the baby is born. And so, depending on the experience or the expertise of the one doing the ultrasound, usually some of these abnormalities will be discovered before the baby is born. And when it's discovered, then the obstetrician can plan together with the pediatrician or the neonatologist, and they'll start preparing and discussing what can be done for the baby immediately the baby is born. And so some of these things can be detected. But there are others that even with ultrasound, you may not be able to detect it until the baby is born. And sometimes there are some that occur during the birth period. So those hours surrounding the labor and the delivery, and even just immediately after delivery, there are certain things that can happen that definitely were not present during the time of the pregnancy, so wouldn't have been picked up by whatever tests or whatever scans that were done. And there are some of the abnormalities, such as the Down syndrome and other syndromes, that usually, apart from the ultrasound scan that can be done, there are some laboratory tests that can also be carried out on the mother that would suggest that the baby coming has some defects or some abnormalities and would need special attention. And so with that, you even have to start preparing the mind of the mother and explain what you think is going on. And I think with some areas, I know with some areas, once they detect certain abnormalities, they speak to the mother and the father, the parents, and they take a decision as to whether they should terminate the pregnancy or they should go ahead and allow her to proceed with the pregnancy, because some of the abnormalities occur because of some developmental problems during the pregnancy, and so may not be compatible with life. So at the end of the day, if you give birth to a child that will die shortly after birth or within a year of birth, then is it worth going through the 9-month journey to get to that point and still go home with a child, or probably not even go home, because some of them don't even make it past the first month of birth? Is it worth going through the full mile just to
Like,
go
my
through
friend is an
the pain
abortion,
of
and they don't want to be
losing?
seen having an abortion, so
Well, that it all depends on how well they understand. If they insist they want to go ahead, definitely it's their right. That's why ours is to counsel, to suggest to them, but the decision still lies with the parents as to whether they want to continue the pregnancy or not. But there are some that are compatible with life, so we just inform you of the abnormalities that have been seen, and then just to prepare your mind that this may be a baby who needs special attention, not just the week following delivery, but probably for a lifetime, depending on the features that they come out with. So all these processes would help us detect whether there's an abnormality even before the child is born.
there are times that we hear women say that I carried my child for 10, 11 months. Meanwhile, we are grown to understand that after 9 months, the child is supposed to be born.
So
Are you a victim of that?
Yes.
At what point? How
the
long?
first one, I passed the 9 months.
okay,
That's
so
40. But it's, I think, I passed 40 weeks. Like some
So that was like
two,
10 to 11 months.
I
Wow.
think it was 10. I was entering to 2 weeks came and add on
The 10 months.
no, then 9 months.
Oh, okay.
Okay.
I think that's a bit normal.
40, I think that was 40
I think it's
weeks.
36
Okay.
weeks.
So
If it's 40
pregnancy,
weeks, then
we usually classify it as a preterm, term, or post date or post term. And so with a term pregnancy, that is the woman has carried it to 37 completed weeks.
okay.
That's so would probably just say 38 weeks plus or minus 2 weeks.
Okay.
So in that case, if the mother the woman delivers, that's plus or 40, sorry, it's 40 weeks plus or minus 2 weeks.
Yeah.
So that would give you 37 completed weeks or 38 weeks and or 42 weeks. But usually after 42 weeks we'll term it as a post date,
okay.
which I think occurred in her case. But
yeah.
for us to get to 41 weeks, we don't usually wait, even though the theory or literature says 40 plus or minus 2 weeks. We don't wait to get to 42 weeks completed before we decide to intervene. Usually when a woman gets to 40 weeks, has not delivered, they ask her to come the following week. And if by the 41 weeks they are still not seeing any signs of labor, then they intervene. So usually that is what would happen. But you know, if you are going to divide 40 weeks, then that's actually 10 months, right? Because if they are normally 4 weeks in a month.
Yeah.
There are some months that will have 5 weeks, but they are usually 4 weeks. So that would be like 10 months. So I think even before I went to medical school, I also heard, hey, this one, they call him Dokrugu because he came at 10 months, he came past 10 months, so he's an old man and all that. Yes, but it's still normal per our definition of a term pregnancy. So 40 plus or minus 2 weeks. So that's a period of 38 to 42 weeks, and that is normal. So before then is preterm, and then beyond or past that period is now the post date. So I think that should clear our minds a bit.
The time too that they brought the child out, like there wasn't any stamina in the child. Like,
Can you speak a bit louder?
like there wasn't any stamina. I would say like
The child was felt weak and couldn't even. Yeah.
So I think from what you described, you said the patient, your baby was suspected to have aspirated meconium, and usually for patients, if you even walk into any ward right now and you see a patient on oxygen, there are very few patients you see struggling to breathe who have the energy to be active and moving around.
the breathing wasn't all that.
So in that case, once there's compromise to the breathing, the body would want to conserve or direct all its energy to the vital organs, of which the muscles for movement are not really treated as priority at that time. And for a child that was born critically ill and had to be admitted for up to 2 weeks, it is very understandable. Okay, so they had to focus and solve the critical issues, the life-threatening issues, because once you are not breathing, then it just a few minutes, within a few minutes, you can be gone. And so that is what's needed to be sorted out. And so I believe they sorted it out. That's why baby is alive today.
They gave her oxygen.
Yeah, and also because if there's any delay in a baby breathing, it can lead to brain damage, which would further lead to these children we have with special needs. And so at that time, the most pressing thing they needed to sort out was the baby's breathing, so that once baby is able to breathe well, then oxygen and every other thing that is needed gets to the rest of the body, and then baby is able to survive through that period and then develop well. So it's understandable. As an adult cry, if you are drowning and they bring you out of the water, the first thing you want to focus your energy in is to breathe and not necessarily to
Yeah.
move or to sit up and start walking. And so it's very understandable. Yeah.
At what point do should I say medical doctors or the mother request, or they have to be CS? It's like most of us are afraid of CS. At what point is it medically advisable to let me say carry out a CS on a mother?
So I think there are a number of indications. There are so many things that would make your obstetrician or whoever is attending to you suggest a cesarean section. But I think the guidelines have been revised such that even if you opt to go for elective surgery, you can explain why you want to have a cesarean section to your doctor. You may be allowed to go through. But I know in our environment, most women are comfortable going through spontaneous vaginal delivery because our system
makes
is
you
such
a
that
woman.
they feel that if you have gone through a cesarean delivery, then you are not woman enough to push the baby out. But that is not the case. For a woman to have elective or even an urgent or emergent cesarean section, then usually there are a number of things. It's either the life of the mother is at risk if they delay the delivery of the baby further, or the life of the baby is at risk, or both may be at risk, and so labor hasn't started but the baby has to come out. So those are the broad categories. So by the will of the mother or the choosing of the mother, and also by to save the life of the mother or to save both baby and child's life. And so those are the broad reasons why cesarean section may be advised. But in most instances, I think it's the second and the third reasons.
Can a mother just come and say that I don't want vaginal birth, I just want to go through CS?
Yes,
Okay.
you can. But you also have to give us reason enough. It's just if it's just because, oh, me, I don't. It's like
I
you
don't
have to
want to
convince
push.
us. You don't want to push. You have to convince us because at the end of the day, we also have to explain to you what the complications are that may come with a cesarean section, and why we think you can succeed if you go through the vaginal delivery. But definitely at the end of the day, the obstetrician or the doctor attending to you would weigh and consider the lives of both mother and child, or mother and baby. Sometimes it's more than one. So they have to look at all these before they actually go ahead with that.
Let's talk a bit more about nutrition after the child is born. We are told that the breast milk, the first set of breast milk, is the most important. Did you give that to your babies? The first breast milk that came out.
Yeah, but where she was lying, I was also lying in a different room.
Oh, okay.
Okay, because I was also having
Like recovering, yeah.
at that time. So I have to squeeze it in a cup and they'll send.
Okay, but it was a first breast
Yeah,
milk.
that
Okay.
yellowish.
Yeah. I learned that is the most
Most-
nutrition. Yeah.
I think you are referring to the colostrum.
So
Yes, so I think in a setting, I think some people believe that it's dirty because of how yellowish it's looking and all that. But it is packed with nutrients that are adequate for the baby at that time, for the newborn. And so God in his wisdom packaged breast milk such that every nutrient, every water, every energy source that is needed for the child to survive has been put into the breast milk. And research has been done by scientists, whether they believe in God or not, has been done over the years, and it has proven that within the first 6 months of life, breast milk is all the baby needs. Unless there are special conditions where the mother is not able to produce the breast milk, or certain conditions, mother is not well enough to breastfeed, or maybe mother has an infection that they discuss and decide, because even infection is not a contraindication unless they discuss and decide that, well, instead of you mixing the breast milk and formula feed, why don't we just go with one method, and then they settle on formula feed. But breast milk was and has been proven to be the best source of nutrition for the newborn, and we advise, or we advocate, start of breastfeeding very early. So now the practice is supposed to be, and so in most tertiary institutions, even if the baby is delivered via CS, the baby, once the baby is breathing and there are no emergencies surrounding the birth of the baby is given to the mother, so that skin to skin attachment is done.
I see that.
And even with that, once you attach the baby to the skin, instinctively the baby starts searching for breast. And so breastfeeding can even be started right on the operation table. And with those spontaneous vaginal delivery, it's even easier to start attachment. So we encourage attachment as early as is humanly possible. And that really helps with the bonding between the mother and the baby. And not just the bonding, but it also helps the general well-being of the baby, because the baby needs to be kept warm. By attaching to mother's skin, already baby is receiving warmth from the mother. The baby needs that attachment to the mother, and that is achieved through early attachment to the mother. So sometimes when mother is very critically ill, or the baby is critically ill, that is when they may separate them for a period, but they are supposed to be brought back together as soon as is humanly possible. Because if you deliver a baby who is not breathing, it doesn't make sense to attach the baby to the mother when you really need to get the baby to breathe within the first minute of life. Yes, so there are a few instances where it's necessary to separate them. But even with that, as soon as the baby is stable, the baby is brought to the mother to initiate breastfeeding. And in a case where the mother is stable, she may be asked to express the breast milk, so that as soon as we can feed, we give it to the baby. And once the baby is stable enough to be able to suckle on his or her own, then we attach to breast. So we teach the mother how to attach to breast, so that the baby is able to get the best of breast milk for the mother. Then beyond 6 months, that is when you need to introduce other feeds, because beyond 6 months, the breast milk is no longer sufficient. And so you have to start your complementary feeding. And that is when you start the porridges from your liquid to your solid diet. And that one is usually varies. Some children, right from 6 months, they want to start eating banku. You are eating it and you can see that they are salivating. But it's all differs. Every child has their likes and dislikes, just as we are all different individuals. Yes, so usually
it's getting really interesting here. Let's go for a break. When we are back, we wrap up on this episode.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of Kingdom Dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
care of yourself when you get pregnant. LP, I see a lot of women who, when they get pregnant, okay, some can be unintentional, but some of them, should I say, they don't take care of themselves again. Of course, some might have bigger tummies than others. But is it like pregnant women are naturally not, I don't know how to put it. Some of them are not really cautious of the pregnancy, for lack of better words, cause someone
Is it cautious of their dressing and
everything,
general well-being?
everything, general well-being. Some don't
Okay.
even take their medications. Some don't go to the hospitals anymore. Their dressing is also inclusive. It's like they are just there. And we have this term that says that God looks after the child. So they don't even want to go to antenatal and all of that. What is your advice to women out there who may be doing some of these things?
Okay, so I cannot overemphasize the fact that it is very important for a pregnant woman to enroll in the antenatal. I think we already outlined the benefits that come with attending the antenatal clinic and seeking antenatal care. And then also with taking the supplements that you are given, because that is supposed to help the development of the child, and especially the folic acid. I think they give multivite as well, and also iron. So in her case, if you remember, she said at a point her HB was low, and they asked her to take green leafy vegetables just to boost her HB. And so that is anticipated. So the medication are given to prevent you from even getting to that point where your HB goes so low that they have to transfuse you, or they have to give you further medications in order to improve it. Because once you have low HB, you are sharing the blood you have in your system with the baby. So once it's low, it's not just going to affect you alone, but it's also going to affect the baby in your womb as well. And so that is why you have to optimize it as much as is possible. And that is what the medications are for. But I think in our setting, some of the women believe that if they take the medication, they eat so much, and because they eat so much, the babies will become big. And once the baby becomes big, the doctor will advise cesarean section. So because she wants to push the baby out and be termed a real woman, she doesn't even want to take the medication. And mostly that is the reasons, those are some of the reasons we get from mothers who don't take their medication. They don't want to have a big baby because they want to push the baby out with ease. But then you see the issue is that it's not only the size of the baby that may complicate a pregnancy. There are other factors. If the baby is too small, the baby now comes out, and there are certain things that have to be done for the baby, because the baby is at risk if the weight of the baby is too low. So the baby may have to be admitted because the baby is too low. The weight of the baby is too low. And so baby has to be admitted, special diets given to the baby to pick up before they go. And also there are certain complications later in life that they could experience because their weight was too low at birth. And they could even die if they are too small. They can easily become cold because there's not enough body fat. We call it brown fat. There's not enough body fat to be able to heat their bodies up. And so all those, having a baby who is also too small is not a good thing. So I'd like to encourage our mothers out there, when you're pregnant, please attend antenatal care, no matter the cues. Please attend antenatal care, and then also take your medications. Take your medications. It would help the baby, and it will help prevent so many complications that can come with pregnancy. So please do attend. Take care, take your medications. And pregnancy is not an excuse to overlook your general well-being. So we already advised on nutrition. Take a balanced diet. Sometimes cravings can make a woman want to eat very unsavory dishes or very sweets. So you get a woman who is pregnant within the first pregnancy. Oh, if I eat food, I'll vomit. So they are taking snacks and sweets and ice creams and whatnot. That is also not healthy because it's not balanced. You're not just eating for appetite, but you are also eating for the well-being of your baby, because that is the crucial moment at which the crucial time at which the baby's organs are developing, and a balanced diet is needed to supply to the baby to also pick on these nutrients and be able to develop normally. So that is the time that you really have to pay attention to your eating as well, and not just follow cravings and eat sweets to fill your tummy, and you don't eat the actual food that will give you the nutrients for the baby to develop normally. And so those are some of the bad habits you were asking of that can actually affect women. And also, you can look good,
dress well.
look lovely, and look lovely, so that at the end of the day, you'd still look attractive to your husband, and then you still shine. So pregnancy is not an excuse not to dress
Pregnancy
well.
is not
I
an
think
excuse to
the
dress.
problem sometimes is just the fact that they are stressed. The stresses of pregnancy are so many. You may
There's
wake
no
up not
time to-
feeling well. So if you are not feeling well, you are not even thinking about how your face is looking or how messy your hair is. But then just take a breath and relax, and let the stress go down. At least go through some stress management, let it go down. And for all you know, by paying attention to your looks, just looking at yourself in the mirror might reduce the stress a bit for you. So it's not an excuse not to look lovely.
Madam Patience, your final words as we close the show. Anything you want to tell anyone out there?
Okay. So, what I want to tell those out there that what I went through during my first child, it wasn't easy. So I want to advise them, the pregnant women, that they should always take their medication and always do what the doctor or the midwives ask
Excellent.
them to do.
Okay. Always take your
everything.
medication. Some of us who fear medicines, we wonder whether we can take the medications when we get pregnant. Yeah, so give us your phone numbers. So Madam
I have,
Patience did this pastries for us. If I can get the flyers around.
Okay.
No, you just mention your phone numbers out there.
Okay, 024 55 385 84.
Okay.
Then 020 20 39 4197.
Okay. And what's the name of your business?
Patmos Catering Services.
Okay. Patmos Catering
Catering
Services in Tamale. So
Yes.
she's done all these pastries for us. If you can zoom in a bit, this meat pie. We have what?
Samosa, spring
and
rolls,
spring
then
rolls.
donuts.
Okay, so if you have any events, you also do cakes as well.
Everything.
Everything pastries. Please mention your phone numbers again.
020 20 39 417 or 024 55 385 84.
Okay. So if you want to get some of her pastry, just call the numbers that she has mentioned, or you can give us a call on our official numbers and we can get you in touch with her for any kind of
And
pastries.
food. And food.
And food as well. Eh? All right. Thank you very much for coming. We really appreciate
you for
your
having
education and information on the show. My hair and makeup is by Indips Beauty Salon here in Tamale. Their contact details are on your screen. We are still calling on partners and sponsors for the Reflection Show. 054-9578-512. It's been an amazing year, having to bring you back to back amazing and beautiful content of the Reflection Show. This Christmas season, this festive season, just make sure that you are living strong and you're living healthy. Next year, 2023, we are bringing you great and amazing content you cannot miss. Thank you for watching the Reflection Show. My name is Martha. and Nabila. Have a Merry Christmas.